Welcome to our community conversation on COVID-19. My name is Andrew Soika, and I'm one of the board members of the County Prevention Network, a local nonprofit based in Poolesville, Maryland, that works to improve the lives and empower youth in the areas of mental health, substance abuse, and other issues affecting young people today. Today, we're going to talk about coronavirus and how it could impact our community. I'm joined by Dr. Meg Oberman, a local physician and board member of the County Prevention Network. Thank you for joining us, Dr. Oberman, and could you tell us a little bit about yourself and your work with UPN?
Absolutely. So my name is Meg Oberman. I've been a Poolesville resident for the past 6 years. I currently work up at Frederick Health as an internal medicine physician. I've been practicing medicine for over the past 25 years. I have been part of UPN since its inception 3 years ago. I'm one of the founding members. I'm one of the board members, and I actually serve as treasurer on the board currently.
Just to start, can you tell us a little bit about coronavirus? How do we test for it and the different tests that are out there right now?
Absolutely. So coronavirus, as many of us know, as we hear in the news, is a virus in the coronavirus family. And the reason why it's called coronavirus is under a microscope, it actually looks like it has a crown. It is also classified as a SARS virus, which is a severe acute respiratory virus. It is novel, meaning that we have never seen it before, and therefore we don't know how to completely treat it at this point in time, although we're learning a lot as we go. The most common way to test for it is through a nasal swab, and that's called a PCR swab, where you actually put a swab up the nose and check for it there. And that is about, depending on how well that swab is done, it's about 30%. There's about 30%, I should say, false negatives, meaning that you could have the virus and still test negative. However, as we've been doing more and more testing, the test has become more reliable. The other test that we're doing is called an antibody test, and that's a blood test. That's actually checking for antibodies, whether or not you have been infected with the coronavirus previously. And a lot of people were sick in January and February, and they were flu negative, and many people are questioning whether or not they might have had the coronavirus at that time. And certainly you can ask your physician for the antibody test. Limitations of the antibody test, it's only as good as the suspicion of you having the virus to start with. So some of the limitations are that we don't know how long the antibody will remain positive. We also don't know if you have a positive antibody, if that actually confers immunity, meaning you'll be immune to a coronavirus infection. So really the usefulness is mostly to determine whether or not you have been infected previously, but also we do use antibody testing for previous patients who've been diagnosed with coronavirus and whether or not they've mounted antibodies for convalescent plasma donation, which can be used to help with severely ill coronavirus patients.
And can you tell me a little bit about how it's spread?
Sure. So as we heard, it's a respiratory virus, and so therefore it's spread through respiratory droplets. So although the coronavirus is quite small, it doesn't have wings and it doesn't fly on its own. So it actually requires a host, and that's in the form of respiratory droplets. So respiratory droplets are normal. When we talk, we pass along respiratory droplets. When we sneeze, we cough, we sing, we yell. We all pass around respiratory droplets. And so that is actually how it's passed. And respiratory droplets can actually travel in the air, but also they can land on hard surfaces. And so that is how the virus is spread.
And with it being able to spread in so many different ways, obviously a lot of people are being infected. Which type of people are, I guess, most at risk? Which populations are most at risk?
Sure, absolutely. So our frontline workers are most at risk, right? So, our essential workers, our healthcare workers are definitely at increased risk. Other patients that are increased risk are those who already might have a compromised immune system or have chronic medical problems. We know that it's hit our elderly population quite hard. It's also hit patients who have pre-existing medical conditions, and those include things such as obesity, diabetes, high blood pressure, a history of heart disease, are some of those things, although we've also seen it in children as well. And so we don't know exactly why certain patients get it more severe than others, and again, it's a novel virus, and so we're still looking into that.
So we're seeing that it's affecting certain demographics more so than others, like the African American community and the Latinx community. So why is that?
That's a really good question. And we think that it's most likely due to a long history of health disparities within within those populations. We know that access to care is more difficult among certain populations in our country. We also know that good quality healthcare is more difficult to access within certain populations. Some families are multi-generational in the same house. Some of these people are in frontline worker. We just said that frontline workers are at higher risk. And some of these jobs, people are in a frontline working position, and therefore they might be bringing it home, and they live in a multi-generational house, and healthcare is not accessible. And so it's very multifactorial of why that is. I would just want to emphasize it is probably from previous lack of good quality medical care in our country.
So how can we prevent ourselves and other people from contracting the virus?
Absolutely. So those are some really good questions. So there's some good evidence out there that three things that we keep on pushing, and you see it, pushed out by the CDC and some other health organizations. One is mask use, and there's been a lot of controversy about mask use, but mask use has actually been studied. There's actually a really good study back in 2009 that was done with specifically the flu virus. And at that time, they actually did a study, and they did it among household contacts, and they did it with people with masks or without masks. And they noticed that the flu was spread to family contacts who were not wearing masks more readily than those that did wear masks. And therefore, they actually made a prediction at that point in time that if there was a pandemic that was to occur of a novel virus, this was back in 2009, which is just like crazy, that actually mask wearing could actually be the first line of defense. The Journal of Science magazine just came out and kind of talked about different countries and how they have combated the coronavirus. And, in Asia, they had SARS virus back in the early 2000s. They already had the infrastructure in place for this. And in Taiwan, actually, they implemented wearing masks immediately, and the spread of virus was truncated significantly to the point that the amount of infection they had was very minimal. So mask wearing is really important. And again, to wear a mask is mostly to protect the other person, not necessarily you, but actually if both people wear a mask, they can actually decrease the risk of infection by 80%. So wearing a mask is really, really important. The second thing is social distancing. We know the virus is spread through respiratory droplets, and we know those respiratory droplets can travel. With normal talking, a respiratory droplet can actually travel 6 feet. And that's why we use the social distancing measurement of 6 feet as the minimum of where you should be from someone if you're not wearing a mask, okay? But we know that they can actually travel farther if with more velocity. So for example, if you're singing or you're yelling or you're talking really loud, then those respiratory droplets can actually go farther. Or exercising is another thing if you're breathing hard. So we do recommend mask wearing, even if you're going to socially distance. I would recommend both, to be honest with you, if you can tolerate it. It's the summer months, and so it is getting more difficult to wear a mask, but I would recommend to try to do it. The third thing is hand washing. So the outer envelope of the coronavirus is actually made of fat. Just like you're washing your dishes in your sink and you have greasy dishes and you use hot soap and water, the soap actually cuts through that grease. And that's exactly what happens with the coronavirus. So washing your hands is really, really important. I talk to my patients a lot about the difference between a public space and a personal space. So I use the example of going to a grocery store. The grocery store, you're doing your grocery shopping, you're touching areas that other people have touched, and then you go to pay for your groceries. And then suddenly to pay for your groceries, you're going from a public space to a personal space into your wallet. I recommend to sanitize your hands between each of those spaces. And you can just use plain old hand sanitizer with at least 70% alcohol in it to help sanitize your hands. I don't recommend that you have to wash off your groceries or wipe down your groceries, but sanitizing your hands is really important numerous times throughout the day.
And as we're transitioning now to this period where the state's opening and the county's opening, people are, of course, afraid about going to public spaces, seeing their loved ones, and sending their kids to public spaces like schools. So what are some things loved ones can do to decrease their chances of putting themselves at risk?
Well, I think the first thing we can do, which is great in the state of Maryland, is we can actually get tested. So we cannot neglect the effect of asymptomatic spread of coronavirus. We actually think that 40% of cases of coronavirus occur from asymptomatic spread. And what's great in the state of Maryland, which is not in all states, is that actually they're now providing asymptomatic testing to patients throughout the state. If you want to go visit a family member who's vulnerable, or you've just gotten back from a vacation and you're worried that perhaps activity you did might have exposed you to coronavirus, or you're a healthcare worker in your high risk situation, you can actually, without symptoms, go get tested for coronavirus. And that test is the nasal test. That's the nasal to see if you have active coronavirus. So that's one thing I would recommend. The other things I would recommend is just things that we chatted about before. So, in order for us to return to normal, quote unquote, I'm not sure when we will completely return back to normal or if we will ever return back to normal, but we need to start talking about how to mitigate or lessen our risk. And so simple things like, if you want to go visit your grandparents, if you've been engaged in a high risk situation, go get tested first, so that you're not putting your grandparents at risk. If you can't get tested, then, I'd recommend an outdoor environment, your social distancing and wearing a mask, not sharing serving utensils, and really try to help lessen that risk. I know a lot of people want their kids, kids are getting, especially smaller kids, they want to be able to play with each other. Remember that coronavirus spreads in clusters. And so therefore, it just takes one person to bring it into that cluster. So understanding the reality that we're social beings, that we want to be with other people, is really important just to continue to talk about the preventative measures we did before: washing hands, getting children to wash hands, getting children used to wearing masks, social distancing as much as we can to try to mitigate that risk. So those are the things that I would recommend.
So making these new habits that can be our new norm as we're transitioning.
Exactly. Mm-hmm.
Thank you. So what are some things we can do as a community to ensure that we as a group stay safe?
So I think Poolsville is a really small community, but we're a really caring community. And so we have to start looking out for our neighbors. And so there are some people that are very scared to leave their home still. And so we need to check on them. We need to see if they need groceries. We need to make sure that they're okay. There's a lot of people that have not seen some of our elderly patients, have not had any contact with other people in a number of months. They don't have the luxuries or know how to use a cell phone or have smart technology like we do. And so really there's a lot of loneliness happening. And that's not saying that we should decrease our preventative measures or get lax in our preventative measures. We just need to start looking out for these people and recognizing and checking in on them and see how they're doing. It's really about taking the individual responsibility of each and every person to make sure that our community is safe, because it really just takes one person to bring the virus into our community and infect others.
Well, thank you for speaking with me today. Do you have any final pieces of advice for our listeners?
I would just say stay safe. It's the summer months. As we're starting to relax the restrictions in the state of Maryland, we've done a really good job. And we've seen states that didn't have those preventative measures in place or open too early, and we see that the cases are starting to go up.
Texas,
and
California.
So, yep, absolutely. And and we don't want to be that place. We want to keep on staying. We've been really aggressive. Our state government, I think, has done a fabulous job. Our local health departments have done a fabulous job. I think the introduction of asymptomatic testing is key for us to be able to control this and isolate each other, but also continue with these preventative measures is really important. And one of those is wearing a mask. And I know there's lots of controversy, but I'll tell you, as a doctor, we wear masks all day long. And we do that to protect our patients. And so because we find it's our responsibility as physicians to protect our patients. And so therefore, we ask that you do the same.